In terms of logistically or even emotionally, wherever you want to take them, what are some of the biggest barriers you and your team have encountered?
By the way, just as an aside, that number is now 2,000. So the barriers to doing street medicine are, a lot of them are kind of inherent to them being on the street, where their lives are just very chaotic and we're kind of trying to follow them around town. And they have very little resources. So that's a small percentage of the barriers. The larger barriers are systemic and societal, where we feel like we are constantly fighting a system that doesn't recognize them as existing. So, for example, I mentioned street medicine getting reimbursed. So some of the major things that we're dealing with from a just purely healthcare standpoint is that when you seek reimbursement for a visit, you bill what you did medically and the place where you did it, the place of service code. There's no place of service for the street. There's, clinic, RV, homeless shelter, campground, cruise ship, all kinds of places. But there's not one for the street, for under the bridge, for behind the dumpster and stuff. So depending on your risk tolerance, some people, about 25% of street medicine programs have tried to bill, but the rest of them aren't even trying to. And so by not recognizing the street and the people who live on the street as existing, then we're not recognizing their right to life and the street medicine that they rely on to survive. And there's all kinds of other things that just stem from that their reality is not recognized. Another example of what we're working through is that managed care. So what happens is when you get Medi-Cal or health insurance, you get assigned to a insurance company and then they assign you to a primary care doctor. But if you're living on the street and you can't access that primary care doctor, you're not able to get that care. And they're kind of like the gatekeeper. So things go through them, specialty referrals, wheelchairs, things, all have to be done through the primary care doctor. So when we see them, we can't bill and we can't access their benefits. So we're working to make it that street medicine providers can get paid, not just the PCP who's getting paid to do nothing, because they're not seeing them, we are, and that we can access their benefits. So in California, we're working towards that. We seem to be very close to getting that, but nothing in the rest of the country is coming close to that.
Yeah, I just want to take a moment and just honor the new figure of 2,000 death, since and once again, it's not pleasant to imagine the death of 2,000 individual human beings who look like us, who are make up of the same genetic makeup as we are, right? But 2,000 is a staggeringly high number. And as you said, the interview was pretty recent. So I just want to take a moment and honor that. And yeah, you talked about the barriers in terms of, I guess, connecting the patients to the care providers. Would you say the whole billing situations or insurance is part of the barriers? Because as insiders, as you know, insurance is a behemoth in medical. And a lot of the systematic issues that's, I guess, weighing down healthcare as a whole is insurance. And of course, your patients' demographics deal with Medicare and governmental insurance. But do you have any challenges dealing with insurance issues?
So there was a bill that we were involved with called AB 369, the Street Medicine Act, which was introduced by Senator Kamlager, who has been just an amazing advocate for our work. And the bill was designed to fix some of those things. It was eventually vetoed by the governor, but it passed through the Senate and the House unanimously. But when the governor vetoed it, he said, they have some really good points. Let's work through those points. There were some things in the bill that he didn't like, that the governor didn't like, but he didn't oppose the foundational piece of it. And so we've been working with the state, with Department of Healthcare Services, DHCS, on these things. And I have to say that they have been such a pleasure to work with. I don't know how many people would say that the state has been a pleasure to work with, but I've really enjoyed it. We have a group that's advising them, and I feel like we're making progress. We're not there yet. We have a long way to go, but the purpose and the goals of the group, we share common values in that we want the people living, who are experiencing homelessness to get care. We share that. And we're willing to do new things in the system, not just say, well, this is the system, figure out a way to fit them into it. That's not the approach. And so even though we have a long way to go, we've had some wins, collective wins, not just wins for street medicine providers, but a long way to go in that way. And part of that recognition is, again, going back to recognizing their reality, and that as long as they're on the street, we have to create a system around them. So we talk about letting the streets build the program, that the second I start to build it, it's going to be a huge embarrassing failure. And so that's what we're trying to do.
Once again, I admire your hopefulness and your optimism. As you said, it's not, especially in 2022, I haven't heard anyone saying that, oh, it's a pleasant to work with the government. So that's definitely very refreshing to hear on so many levels. But it is helpful, though, because I think when you view government, like the government, as this totality, people are like, oh, no, it's the government. It's overwhelming. But I think what you're doing is you're dissecting and distilling into the individual components of individual decision makers who are comprised of the government. In that sense, I think it makes your work a lot more manageable, because it's not the government, but it's like, oh, these are other people like me who happen to be in a positions of power, who happen to could influence policies in a certain direction. And I think that's very, very useful, especially in this current burning political climate.
That is exactly right. Is that people talk about the system as if it's this behemoth that we can't influence, but the system was created by and led with people. And a lot of times, just like we try and empower the people we're serving to make changes in their lives, maybe they're using heroin or crack or something, we empower them that they have influence over this. So too, we have to empower our leaders that, like, you actually can influence the system. If you think the system is bad, you have the power to make a decision. And so we can change the system. But the people in charge have to feel like they have the power to do so. And sometimes it can be a little bit of and this has not been my experience with these people, obviously, because we are making headway, but sometimes it can be a cop-out for a leader to say, oh, that's just the system, and feel powerless to change it. Obviously, it's not true in all cases, but we can't say that it doesn't exist.